Good morning, it's Dr. Jeffries again on Tpj Health Talk. We have been talking about vaginal discharge for the past few days, and I thought we should veer off a bit and talk about something that is very common nowadays, and that is the HIV infection. I think the dread around HIV has made it so popular because it has been believed that once you've been told that you have this infection, then that is the end of life. We're going to be talking about how people can contact HIV, what you may expect if you've come in contact with HIV, and what the cause of the disease is. I said on my last video when I was talking about chlamydia that we cannot overemphasize the place of sexual health, that is taking care of yourself in your sexual life. The most important way you can prevent yourself from having a sexually transmitted infection is to abstain from sex. And if you're married, to have sex only with your married partner. And if you have the couple being faithful to each other, the likelihood of picking or coming in contact with an infection is very slim. HIV, the short form of human immunodeficiency virus, is a very bad infection. As I said, it is a virus, and what it does is to affect the immunity of the human body. It makes sure that you cannot fight the typical day-to-day infection that you may come in contact with. Once the HIV virus comes in contact with your body fluid, which would include blood and saliva, and any liquid that comes out of any part of the body, and this goes within your system and it settles, usually a few weeks after this, the individual who has come in contact with the virus has a slight fever. They feel generally unwell. Most of the time they can't put their finger on what has caused this illness, and then everything calms down. Unfortunately, the virus may remain in hiding within the body for such a long time, during which it starts to affect the immunity of the body. Usually, most people would do well after they've had a cold, or they've had a sore throat, or they've had a tummy bug. But what happens when you have HIV infection is that the normal immunity that you have, that you can mount up a fight or a resistance against these common bugs, is lost. And what is supposed to be a simple tummy bug ends up continuing for weeks to months. The HIV virus depletes your body of every ability to fight. Over a period of time, your blood cells start to decrease, and then it starts a chain of reaction which at the end of the day can kill the individual. How can you contact the HIV virus? The very frequent way by which people contact this virus is through sexual intercourse. Apart from this, you can contact the virus by going for surgical procedures, and they use instruments which have not been sterilized. It's not just washing the instruments in water, in hot water or cold water. It is with very serious cleaning with appropriate gadgets and chemicals if necessary. This is not going to be a long talk today because it's going to be in parts. I'm going to be leaving a word for my sisters. If you're going to be going for ear piercing, you're going to be going for tattooing, you have extensions being fixed on your hair, or you're going for manicure or pedicure, do ask and ensure that the instruments that are being used on you have been washed appropriately, that they have been cared for. So the risk of you catching infection from another customer is very slim. I'm going to be stopping here today. Tomorrow we'll be talking about other means of catching the HIV virus and what we should do as women if you happen to think that you have come in contact with the HIV virus. It's very important that you watch who you go to bed with, because you can catch their bug. He may look very handsome, he may look very responsible. If you allow him to have any sexual relation with you, you must be ready to carry his bugs. Until then, ladies, keep your knickers up for the right person. It's Dr. Jeffries, and I'll see you tomorrow. Thank you for listening.